we'll begin now. Thank you all for your patience as we allowed a little additional time for people to join us in the room and be comfortable. We're really delighted to welcome you all to this session today, and both those of you here in the room with us, and we appreciate that we're competing with lunch breaks and other sessions and the sun outdoors, so we're grateful to you for joining us, but also a very warm welcome to those joining us on the live stream. We're really pleased that we've been able to present this event in a hybrid format, and we're grateful to everyone for their patience as we made it work in both formats. So I'd like to welcome you all to the session. My name is Jackie Stevenson. I'm with the United Nations University International Institute for Global Health, and we're the UN's think tank on global health. Our role is to produce policy relevant evidence and analysis to inform the development and implementation and evaluation of health programs. And we have been really proud and delighted to partner with UNDP on the project that we're presenting in this session today. And our goal today is twofold. Firstly, we're excited to share with you the lessons learned and evidence produced in our project, but we also really want to invite you all into a conversation with us as we aim to translate the evidence we've produced into policy and into implementation. And we're really keen to hear from you all as well about your own reflections and questions and comments regarding the research. So to start us off, I'm really pleased to be introducing a short video from one of our pilots in Peru that gives you a better sense of the work that's been done than perhaps we could do in a presentation.
El Salvador tiene 48 años de fundación y es un pueblo eminentemente de inmigrantes de provincias. El lema desde un inicio era porque nada tenemos, todo lo haremos.
Y aquellos que quieran presentar sus propuestas, compañeras, de carácter político, que la presenten, que discutan, que debatan, compañeras.
Es importante luchar de manera articulada contra la violencia hacia las mujeres, las niñas, las adolescentes, porque en El Salvador siempre se nos ha caracterizado de esa forma, ¿no? Las luchas no son individuales, son colectivas.
La instancia de concertación para prevenir, erradicar, sancionar la violencia contra la mujer y los integrantes del grupo familiar es un espacio que articula a todas las entidades que tienen competencia en este tema. No solamente las entidades del Estado, sino también a representantes de la sociedad civil, especialmente mujeres.
Desde la instancia tenemos ya todo un plan de acción desde el plan de trabajo. Eso nos está señalando qué cosas es lo que tenemos que hacer para poder disminuir esta violencia hacia las mujeres.
Entre todos, la idea es poder implementar una estrategia de prevención de la violencia con las características de Villa El Salvador.
Bueno, el protocolo de atención que estamos trabajando desde la instancia es una herramienta importante, ¿no? Porque ha sido como un diagnóstico a cada operador. Va a obligar a los operadores de justicia a dar una atención de calidad y calidez a las víctimas de violencia.
La participación de las mujeres es un factor que puede hacer sostenible esta instancia, especialmente son las que viven acá el día a día.
El sueño de nosotras, las mujeres de Villa El Salvador, es que estos modelos, ejemplos de trabajo, se hagan en otros distritos. Tener una ciudad en la cual las mujeres sientan que la violencia está muy lejos de ellas, porque no hay justificación para seguir viviendo una situación de violencia dentro de un hogar.
Thank you. And I'd like to introduce our first speaker, Dr. Erin Stern, who will be presenting findings of the report from our joint project. Erin is a technical advisor with the Ending GBV and Achieving the SDGs UNDP project. She has 14 years of research experience to inform and evaluate gender and health programs, and has provided implementation or research support to a range of NGO organizations.
And then the data was analyzed thematically across each country and then synthesized. So really what I'll be sharing today very briefly is some of the synthesized lessons learned across these three planning and paying models. So following on the theme of P's, planning and paying, it lays out 4 different P's and how we kind of frame the lesson. So the first is the P on potential. I think all 3 pilots and the very different experiences attest to the importance to understanding what is the potential in the context you're working for civil society mobilization and linkages to government. As you saw in Via El Salvador, there's a long history of women's organizing and activism. And the project in Peru really drew on that. They developed and supported a women's leadership network, really galvanizing this history of activism. And that was very different from the context of Moldova, where there's much less history of civil society mobilization in this post-Soviet context. And the project really had to try to foster community ownership and engagement in this kind of development planning process. Another thing is that all pilots had and really tried to draw on what are the institutional mechanisms that already exist that could be used to support this planning and paying approach. So in Indonesia, there's this, what they call these village development funds that are at a very localized level. And they were really interested in kind of tapping into that. They have mandates to do that, but also recognize that women did not always have, it was important to build women's leadership and their ability to contribute to this planning process. So really just understanding what is the potential, what already exists that can be used for a planning and paying model, and what is the potential that already exists that you have to better understand or harness is an important thing to be aware of with this planning and paying model. We're just waiting on slides, so I'll just go to the next P, which is the P of principles. So we also in the lesson learned report list out some principles of doing this kind of work that really came up strongly across all 3. So the one is to do no harm. So, when you're doing this kind of participatory planning, you're going to bring in actors who might have no violence prevention experience. And this can bring up issues around safeguarding, around the importance of having kind of emotional support and care that needs to be considered when you're bringing in a diversity of actors in this field. The second principle is, as you can see here, ensure a diversity of women represented. And it was really important that all of the pilots brought an intersectional understanding about women and girls who are at the table in the planning process and ensuring that this local planning was as inclusive as possible. The third is the importance of building trust with the planning process. So there are varying degrees of mistrust between civil society and local government in these 3 different pilots. And so it was really important to think about how to build trust with the planning process between these diverse actors, particularly between kind of women's groups, civil society, and government. The other principle is this importance of developing leadership skills to address power dynamics. So all the pilots were really confronted with dealing with patriarchal issues, particularly when you bring together women from the community working with leaders, many of whom are men. And so it was really important to support women's leadership and kind of capacity development so that they had an equal and meaningful voice at the table. Other is this, so we call this the kind of politics of this planning and paying approach. So as I mentioned, there was interest in kind of thinking about there are these different silos, right, with our sectors, with all these different sectors, whether it's education and health and justice. And not only can that sometimes limit coordination, but it limits shared and pooled funding. But trying to pool funding is intensely political, right? Because there are all these different demanding, competing priorities for funding. And so kind of being aware of the politics of this and trying to put women at the center of negotiating this and kind of subsequent budgets being attached to priorities of the local action plan was something that came out really strongly across all 3 pilots. The other is to analyze and address socioeconomic determinants of GBV. So each pilot interestingly used formative research to gather and analyze data on the socioeconomic drivers of GBV. And this was used to help develop local action plans and again, think about action plans that can help achieve a range of SDGs and involve a range of actors. The next principle is just to integrate and innovate with both, although these were violence prevention programs, all of them made efforts to also integrate with response. And we know that this is really best practice and important, so that came up as a key principle. This notion of building an infrastructure for accountability. So all the projects, through using what already existed, these local coordination mechanisms, aim to really help formalize public accountability for commitments that had been made at the local level to things like these national action plans. And finally, to plan for sustainability. So the fact that this was really engaged at a local level, there's evidence that that helped ensure the sustainability and relevance of these local action plans. There were tools kind of developed, including things like how to replicate the planning process that helped a kind of technical question of sustainability. But there's still some question around how long will these be sustained, particularly now with the UNDP portion funding ended. So it is still important to think about this kind of plan for sustainability with this planning process. Okay, so the third P is processes. So kind of reflecting on what are the processes of this planning and paying approach. The first is tools, and you'll see this in the report. There's also an amazing resource on this UNDP website that we'll share, but all of the pilots developed a range of tools in terms of how do you diagnose the situational analysis? How do you do participatory planning? And also, how do you advocate to key stakeholders that this is something people should get invested in, especially those sectors outside of the violence sector? So in the video, they mentioned this cost of the cost of no investment. So UNDP in Peru and the project in Peru helped to fund the first study looking at what is the cost of not investing in violence prevention. And that turned out to be a very powerful tool for the team in Peru to use in terms of making a case of why you should invest in this work. All of the projects were implemented amidst the COVID pandemic. I think with their kind of this local adaptive responsive model, there was some incredible learnings around how to adapt to pandemics and how to adapt to changing circumstances. Moldova, in addition, also was affected by the crisis in Ukraine and the war. And again, some amazing achievements around there was a safe space that was operated in Moldova as part of the local action plan, and that pivoted and responded to accommodate more than hundreds of Ukrainian women and girls fleeing Ukraine. The final kind of progress is thinking about this issue of shared resources and shared budgeting, and resource mobilization. And the pilots did face a range of challenges with this progress. And I think an important lesson relates to the need to work earlier and more intensively with those who have decision-making around budgets in kind of key sectors and government departments to get more of their support, because it was a really challenging thing for all of the pilots to achieve. Okay, and finally, progress, the final P. So just in terms of thinking about, okay, the impact of the participatory planning, we definitely saw had an impact on the local action plan quality. Local action plans that were more responsive to the needs on the ground, involved more sectors, and really like thinking carefully about the key drivers and protective factors of violence. So definitely think the hypothesis of these local action plans can be higher quality, definitely is quite clear across all 3 pilots. Also, the importance of just women being involved in the planning process, especially when you really make efforts to support their meaningful engagement, their leadership skills, that having an impact as well. In terms of the impacts on GBV, these pilots were not evaluated to assess things like prevalence. Did they reduce prevalence of GBV? But there are some indications, and you can read more about this in the report, of real difference to violence prevention across the different pilots. And here's just an example of a quote from a safe space staff in Moldova, and just reflecting on the fact they now have this safe space and the difference that it's made in the lives of many women and girls in Kirsova village. So finally, I'm going to go through these very quickly because I know I'm out of time. These are some recommendations. They're all in the planning and paying report, but the first is to address this inherently political question of the planning and paying approach. As I mentioned, this is a political, it's a contested issue, especially when you're trying to get different sectors to work together and also share budgets and try to pool funding. The importance of prioritizing women's leadership and feminist principles throughout this planning process. The importance, of course, of ensuring safeguarding procedures and emotional support, especially again when you're bringing in multiple sectors and multiple actors. To frame ending GBV as a project of social and economic justice. And I think this framing of we cannot achieve all the SDGs without preventing violence against women and girls was a really helpful framing for this pilot and for getting kind of non-traditional sectors involved in this space. To draw more explicitly on the existing evidence base. So while the local action plans did a great job of really honing in on the issues and coordinating kind of multiple voices to develop a plan, I think there was questionable ability around how much they then drew on, well, what do we know works in the evidence? How can we draw on that to inform a more evidence-based effective plan? I think we saw it the most in Moldova. In Moldova, they drew on the CETA methodology to the safe space, which is an evidence-based mental health approach and addresses some of the key risk factors for violence identified through their situational analysis. But I think with this process, thinking about how do you still bridge links between the local level planning and what we know and we're learning about at this forum, the kind of wealth of global evidence that exists. And then the importance of adapting to contextual complexity. All of the pilots have really important lessons around that, as I mentioned, from the COVID pandemic and the crisis in Ukraine. And then finally, the importance of working with senior leadership to facilitate resource mobilization and cost sharing, because this was something that was a challenge. And I think working with those who have a decision-making power, particularly around budgets and allocation and priorities, is really critical. Okay, so that's everything from me. Thanks so much for your time. And I'm very happy that we do have colleagues from UNDP Moldova and Peru who can speak more about the projects and will be now sharing as discussants. So thanks so much.
Thanks so much, Shannon. And thank you all for your attention. For the next part of our session, I'm delighted to introduce 4 discussants who will each give a brief intervention from their different perspectives and backgrounds and institutional outlooks, and then we'll open up the floor to questions. So Diego, please go ahead.
Thank you so much, Jackie, and thank you, Erin, for an excellent presentation. I'm Diego Antoni. I'm a policy specialist at UNDP HQ gender team. And I'm delighted that we're launching today this amazing report that I really encourage you to read because it has very interesting evidence. And of course, you know, the details are always, you know, the rich part of it. But I want to give you an overview about one of the approaches that we used for these pilots, and other pilots are part of the same initiative. And it's the integration approach. You know, it's the GBV lens integrated into non-GBV interventions, which is something that is happening across the board, particularly in civil society, and multilateral organizations, development organizations are slowly coming to that realization that there is a lot of potential. So I'm gonna walk you through 4 aspects of the integration aspect of these pilots, Peru, Moldova, and Indonesia. but hopefully have a broader conversation. So I'm going to start with the why. Why are we choosing to do a GBV lens integration across the board at UNDP? And what were the results in these particular cases? So first of all, we know that tackling GBV is an accelerator for having progress in other SDGs. That is something that is well documented and that you will see in the report. And also we know that tapping into certain SDGs can have positive spillover effects into ending gender-based violence. So that's the first why. The second is that this is not just any kind of integration. We call it collaborative integration because it is, it is grounded on feminist principles, and it also requires trust, role distribution, shared accountability. And you will hear today from the pilots in Peru and Moldova how important it was to really create a buy-in, a political buy-in at the local level. And when we talk about the feminist principles, it's not only shared accountability, balanced decision making, but it's also what we don't want. We don't want this to be top down unless it is for protective reasons, right? We don't want this to be unfocused or without context. So this is the why we did. And the what, and in particular when it comes to local governance, because we are applying this integration approach to other sectors, is the what is very simple when it comes to local governments. It's a process grounded on the localization of SDGs, which is something UNDP has been doing consistently since the SDGs were launched, and then bringing together different local stakeholders around a shared aim, which is making a difference on ending violence against women, SDG 5.2. So that's the what, and that's what you will see in the report and here today on Peru and Moldova. But then the how is of course where everything happens, right? And where having a participatory process makes a difference. And you will see in the report that the first recommendation that comes up from these pilots is really look at the political aspect of these processes, right? So I would like to share with you some reflections about what are the political aspects, but also the bureaucratic ones, the technical ones. And you do have, of course, tensions between the political and the bureaucratic. And these pilots really give very important information about how to go around those tensions. So let me start with the political, right? And the political is also contextual, right? It's the context is different for each of the pilots. You saw that in Villa El Salvador, you had already a tradition of political activism of civil society since the 70s. One of the images that we saw was in 1970 something, right? And that was a very favorable context for what we understand by the political ingredient, which is having a democratic process that is representative, trust building, and that has a leadership component, right? Because you need to have people who understand also about the GBV work, and that involves training of the leaders. And the Justa network, which is the network we work with, provided all those ingredients in Peru. But it's not always about working with civil society that makes it representative, or with the grassroots organizations. Sometimes it's bringing to the table other actors that were not initially involved. So in the case of Moldova, you had, for example, the regional government of Gagosian. That was a very important partner just to make it representative, right? So when we got the buy-in from that regional government, which is also a breakaway region in Moldova, so that was really important. That made the difference, right? And in the case of Indonesia, we were also lucky enough to have the political buy-in, not only at the local level, but also national level. So what does it mean to look at the bureaucratic aspects? So for us, the bureaucratic aspect, which, you know, you could say also technical, it sounds more nicer, yes, less you know, confrontational, because we are precisely trying to bring together all the actors. So the bureaucratic or the technical is really about two things: the multi-sectoral, you know, bringing the different sectors present at the local level, the justice sector, the police, the health sector, and they all have their agendas, their SOPs. They don't talk to each other sometimes. They don't see women's issues as a priority. They need to be engaged since day one, because we don't want the participation of grassroots organizations to be an add-on. So in the case of Peru, you will see that the instancia, and that was reflected in the video, was on board and brought the different sectors together since day one. And also in Moldova, there is a multidisciplinary team that is mandated by the law, but that didn't come to life until we made it, you know, real. So that is super important. And also the evidence-based, you know, you cannot do effective GBV work at the local level if you don't have tested methodologies, if you don't have a thorough analysis of the situation of the SDGs at the local level, for example. And that's what we did in Peru. We applied a methodology that is regional. It's called the combo methodology, and it looked at the situation of other SDGs in relation to SDG 5.2. In the case of Moldova, we brought the CETA methodology, which is approved methodology that has lots of evidence that it works, and it has been applied in other parts of the world. So that's for us very, very important. You know, when you think about the bureaucratic or the technical, when you bring so many different sectors on board, they don't have GBV expertise. And that's very relevant because you need them to understand the safety and ethical principles that are so instrumental and not only instrumental, I mean, they're life-saving, and it's really a human rights perspective that we bring, and you need to train them, right? So when you break silos, you need to bring the expertise, and I'm also bringing an ingredient which is both political and bureaucratic, and it's when those two factors are really undistinguishable, and that we saw particularly when it came to COVID-19. So COVID-19 really derailed most of our interventions, as many of the RCTs and interventions that have been presented in this forum. And because we had built trust, you know, we were able to move from in-person to telephone in Indonesia, in Papua. Because we had built trust, we were able in Peru to move very quickly to a campaign that mobilized more people. So the crises are important. In Moldova also, because of the Ukraine war, we had all of a sudden to adapt the CETA methodology to the Ukrainian refugees. So, you know, that was when we thought this is really important, that we bring the political actors and the technical actors together. The other aspect that is super important and involves both the political and the technical is when you work towards mobilizing resources, because it is not a surprise that at the local level or at any level, ending violence against women has not mobilized enough resources, right? And these pilots were very intentional at looking at who the budget holders are in each circumstance. And what we found out is that the budget holders are usually at a very senior level and sometimes are not even present in the community. And that you need to bring them on board at the beginning and that is a lesson learned for us because they weren't that involved. And that's why we have beautiful local action plans, but we weren't able to mobilize the resources that were needed to implement those. So I'm going to finish up with some of the results that will be presented in more detail by my colleagues from Peru and Moldova. But just to say that these interventions have a positive spillover effect around governance processes and SDG 16. So, you know, we have documented that in the places we had the intervention in, there is a better relationship with civil society, right? So government, civil society work better. But we also have, you know, the leave no one behind principle implemented, right? And that's not only for the GBV intervention, but it becomes something of a principle for other policy intervention. And last but not least, linking the subnational, the national, and the international, right? So that's another positive spillover effect of our interventions, is that we went to the ministry in Peru and provided the evidence that our model in Villa El Salvador was working and that needed to draw their attention in terms of legal frameworks. And the international aspect, which is also very important, you know, GBV needs to be seen as a multinational issue, and we saw that in Ukraine, in Moldova, when the Ukrainian refugees came. Then all of a sudden we were collaborating with our office there and looking at a transnational perspective. So I will end up here. Really read the report. It's amazing. And this is only one of the main recommendations, the political one. And I thank you.
Thanks so much, Diego. I'm going to introduce our next speaker. She will be presenting in Spanish. So if you're here in the room with us, please do take up your headsets if you need it. And for those of you joining us on the live stream, we'll be back to presenting in English shortly. Please bear with us. We're really excited to be able to bring our presentation in both languages of the forum. Mixi is the coordinator of the JUSTA project for UNDP Peru, and we'll be presenting, as I said, in Spanish. Thanks, Mixi.
Por fin el silencio opresor huyó para irse lejos sin regreso. Por fin escuchó la alegría de muchas voces que comparten su felicidad. Por fin tu voz rebelde se oye fuerte en toda Latinoamérica con voz de mujer. No quería empezar sin antes compartir una de las poesías que escribió una compañera, una líder de Villa El Salvador, que es parte de la Red Justa y que en tiempos de pandemia desarrollamos un proceso de acompañamiento psicoemocional y parte de este proceso implicó uno paralelo que era el de escritura creativa. Este libro, este poemario que tiene como nombre Juntas Florecemos, nace de esta experiencia, pero además de esta experiencia tenemos como resultado que esta red de lideresas que se formó para responder frente a la violencia se convirtió en un grupo de ayuda mutua y ahora va diversificando sus encuentros, mirando la salud mental como un elemento básico para responder frente a las crisis. Muy buenas tardes con todas y con todos. Mi nombre es Mixi Paredes. Quisiera agradecer por la oportunidad de compartir parte de esta experiencia global que se desarrolló para Perú y América Latina en Villa El Salvador, modelo que se ha desarrollado de manera participativa. Hoy tiene resultados interesantes que pone a disposición de ustedes y que está buscando también ser replicado. En América Latina, para el 2020, más de 4.000 mujeres fueron víctimas de feminicidio. Perú es el segundo país de América Latina con el índice más alto de violencia sexual. Lima es la ciudad capital, pero a su vez es la ciudad que reporta el mayor número de feminicidios a nivel nacional. Villa El Salvador es uno de los 43 distritos que para el año 2018 fue el primero en reportar violencia. Solo en el año 2018, no lo muevo. Don't move, please. Okay, no, okay. Solo para el año 2018, una de cada dos mujeres fue víctima de violencia basada en género en Villa El Salvador entre los 18 y 65 años de edad. En el marco de esta intervención se desarrolló un estudio que respondía o analizaba cuál es el costo de no prevenir. Para ese año, la violencia basada en género en Villa El Salvador le costó 4 veces más de lo que el gobierno local había invertido en infraestructura. Estos costos invisibles se reportaron, por ejemplo, se pudieron identificar que más del 44% lo asumía la sobreviviente de violencia, más del 11% sus hogares y el 44% restante de la comunidad. Entonces sabemos que la violencia impacta la salud física, mental, el bienestar, la productividad, el desarrollo, no solo de las mujeres que experimentan esta violencia, sino también de sus familias y de su comunidad. Si estos gastos son predecibles, es posible también redireccionarlos teniendo en cuenta los objetivos de desarrollo sostenible. Este estudio también revela lo importante que es mirar la acción comunitaria, el valor de la acción de las mujeres para responder de manera más rápida frente al primer grito de ayuda. Solo en Villa El Salvador, 1 de cada 4 mujeres se ha acercado a los servicios esenciales. Sabemos también que una mujer que experimenta violencia en primer momento va a otra mujer. En ese sentido, y teniendo en cuenta esa problemática, la iniciativa global de este proyecto inició una serie de estrategias en 7 gobiernos locales que respondan frente a la violencia, busquen reducir el impacto de la violencia basada en género en los territorios y aceleren el cumplimiento de los objetivos de desarrollo sostenible. En ese sentido, para Villa El Salvador, el objetivo era construir un modelo que fortalezca la gobernanza local a través de un elemento básico, la acción comunitaria. El objetivo era construir este modelo de carácter interseccional, multisectorial e integral para prevenir y responder frente a la violencia. ¿De qué manera? De manera sostenible, viable y que sea replicado. Un enfoque que tomó como elemento principal la adaptación del enfoque de seguridad humana y el modelo ecológico, que interactúa de manera constante con la comunidad, promoviendo y apoyando a los integrantes de los diferentes niveles del gobierno local a través de acciones continuas de arriba hacia abajo y de abajo hacia arriba, la definición de las propias acciones, pero previamente a la identificación de las causas de la violencia basada en género, teniendo en cuenta el propio contexto. Una planificación comunitaria que mira en la construcción de políticas públicas y de herramientas de gestión local, además de la mano de la construcción de alianzas y de plataformas especializadas para amplificar las voces principalmente de las mujeres. Hemos utilizado como herramientas transversales el arte, la cultura y el cuidado de la salud mental como elementos protectores. Hoy podemos decir que sí se puede fortalecer la gobernanza local a través de la acción comunitaria, teniendo en cuenta el trabajo y la identificación de actores claves en el espacio, generar alianzas para poder promover un impacto mucho más potente y desarrollar siempre procesos participativos para dejar capacidades instaladas. Un trabajo de prevención centrado en la transformación social y en la transformación y en el cambio de comportamiento de la comunidad. El consorcio de investigación grave, que es un consorcio en el Perú, para el PNUD en el 2019 identificó que el trabajo en red, en el caso de Villa El Salvador, para la red, en las lideresas de la red justa, demostraron una baja importante en sus estereotipos de género y frente a la violencia, en comparación con la encuesta nacional de relaciones sociales que reporta más del 58% en mi país. En el caso de las lideresas en Villa El Salvador reportaron un 14%. Queríamos también compartir con ustedes algunos resultados como parte de una evaluación externa que se desarrolló a esta intervención. Se pudo demostrar que se redujo la tolerancia frente a la violencia en la comunidad de Villa El Salvador y que principalmente el cuidado de la salud mental se convierte en una acción comunitaria para responder frente a las crisis. En este caso, la crisis de la COVID-19, previamente en Villa El Salvador se tuvo una crisis anterior muy fuerte. Esta forma fue probada para responder frente a la crisis. Dentro de los logros, la construcción de un modelo participativo a bajo costo que aborda las causas estructurales de la violencia basada en género en la comunidad, validado, sostenible y replicable. Liderazgos fortalecidos con voces amplificadas. Ya Diego lo ha compartido. Hemos impactado directamente a más de 500 lideresas en el distrito. Eso nos ha permitido prevenir algunos feminicidios, fortalecer y focalizar la respuesta de manera integral. Un entorno normativo mejorado. Perú tiene más de 1.825 distritos. El distrito de Villa El Salvador fue el primer distrito a nivel nacional que construyó de manera participativa un protocolo de acción conjunta para responder frente a la violencia desde el ámbito local y se caracteriza porque tiene un capítulo especial que protocoliza la acción de las lideresas para acercar a los servicios esenciales, pero también tiene un capítulo que aborda la atención a la comunidad LGTBIQ+, desde el ámbito local en donde intervienen todos los actores. Dentro del entorno normativo, el plan de acción local costeado, un marco de seguimiento y de evaluación. Hemos aplicado la metodología Combos. Es una metodología que se aplicó al contexto local. Nos ha permitido a través de procesos participativos construir una teoría de cambio, tener una hoja de ruta y evaluar resultados. En generación de evidencia, más de 7 herramientas desarrolladas. Les he comentado solo algunas de ellas. El estudio del costo de la no prevención, guía en masculinidades, guía en acompañamiento psicoemocional en tiempos de pandemia, una página web que da cuenta de todo el proceso, así como la obra literaria Juntas Florecemos, entre otras. Una instancia de concertación plus que reúne a un grupo especializado de actores locales, articulando a más de 30 instituciones, entre instituciones privadas y públicas. ¿Dónde nos encontramos ahora? Estamos en proceso de réplica del modelo. Contamos con el interés de más de 15 gobiernos locales alrededor de todo el país. Hemos iniciado en junio la réplica del modelo en 3 territorios al norte del país, territorios completamente distintos, son territorios eminentemente rurales, así es que en este momento estamos en la identificación de alianzas, la elaboración de diagnósticos para poder adaptar este modelo al contexto local. Muchas gracias.
Thank you so much, Mixi. Our next speaker will be Vitaly, and Vitaly is the coordinator of the project in Moldova and will share some reflections and learning from the project there.
Dear colleagues, sorry. My name is Vitaly Fecăuțanu. I'm representing UNDP Moldova, addressing gender-based violence project. As we see, Jessica and Diego mentioned a lot of things about our results obtained in Moldova. I want to focus your attention on the adaptability of the project and how it's happened in our case. Before starting, just a couple words about Moldova. Moldova is a small country between Romania and Ukraine in the south of and southeast of Europe. And at this moment, Moldova faced with a couple of crises. First of all is and the results of the post-COVID economic crisis, and after then we speak about the new energetic crisis, and the last crisis is about the Ukrainian refugee. If speaking about the legislation of Republic of Moldova, we are very well prepared in this sense. Moldova has a good legislation, and serve as example for other countries from CSI in this matter, and many countries come to us to bring the example of implementation of GBV law implementation. And also Moldova is signed and ratified the Istanbul Convention. And according to Istanbul Convention, Moldovan government shall invest more money and more effort in establishing the infrastructure regarding GBV preventing and combating. Regarding the versatility of our project, this is the main focus of my presentation. As you know, we have a war in Europe, and you can see a couple figures here about the refugee crisis in Moldova. Since the war starting in Ukraine until now, around 500,000 people crossed the border in Moldova, and around 87,000 remains in Moldova. And speaking about this 87,000, you should understand that there are the people who don't have a lot of incomes, and they stay in Moldova because Moldova is a cheaper country comparing with other countries from Europe. From the beginning of this crisis, the government and the local public authorities, also NGOs and other national partners, were involved in solving this crisis, but also the Moldovan families opened their doors and hearts for accommodate refugees in their homes. As a solution, instead of the government was to adapt the existing infrastructure, the existing GBV infrastructure, to accommodate refugee. And many of the existing services were temporarily transformed in RACs, so-called RACs, means refugee accommodation centers. After six months of working with refugees, I can say that the existing infrastructure created for assisting survivors of GBV is very suitable and corresponds with the needs of all refugees. And on the other hand, the created mechanism for preventing and combating GBV is established by the project, such as local multidisciplinary teams, the safe space, the mobile team, is an extension of the safe space, and through the mobile team we managed to work in remote area, especially in the host communities, which many refugees are at this moment. And the good thing of this project that with few adaptations, you can use the existing GBV infrastructure and mechanism to work with both category of beneficiaries. I mean, Moldovan survivors of GBV and the Ukrainian refugees. And this is short demonstrations how the services are compatible for both these categories. Since the end of the February, the safe space in Kirsova is assisting refugees, both most of them mother with the kids and toddlers, and at the same time, the safe space continue to work with cases of domestic violence, and always okay in this combination. Thank you for attention.
Thank you so much, Vitaly. And now for our final intervention, I'll come to Laurie Heiss, the Technical Director of the Prevention Collaborative. Laurie.
Great. Thanks a lot. I think actually I'm more of an avid observer of this project than a direct participant. As you just introduced me, I'm the director of the Prevention Collaborative, which is actually an organization that accompanies groups and processes who are interested in moving into doing more prevention work. Frequently, I think there's a lot more capacity on the ground to figure out mechanisms of responding to the needs of refugees and survivors and the like. But as we move into the longer term prevention, oftentimes we're really on the frontier. So it's funny because I feel like this project brings together quite a few strands of my own life, because back in the 1990s, I participated with a similar project that was actually organized through PAHO, OPS, and created working at the local level, similarly in, 5 cities in Mexico and in Cuenca, Ecuador and Bolivia, and then in the Southern Cone, a few places I was not involved in the Southern Cone piece. And what was intriguing to me about that is seeing how this focus on relationship building and really getting people outside of just their roles, but actually knowing the face and therefore being so much more willing to pick up the phone or to strategize around a new need. That really took hold, and you saw a lot of things that came out of this project long after the actual funding, the catalytic funding developed. And I think the reason that this is important, and I think rather unusual, quite frankly, in the field of violence prevention, is its focus on the local level. I think there's a lot of focus right now about national action plans and all of that. And I'm actually not very sanguine about the utility of that, because people can't really, I mean, then you're talking ministries, then the issues around the distribution of resources and everything are even more complex. The people turn over constantly. You are not really working with the real life people in front of you, right? And that's quite motivating in these types of processes. And the other thing I really like about this is, and I think this is why you invited me, is I do think that there's something about creating what I call an island of success. You have a project, it's doing something, other people can actually come and visit it. They hear about it. It creates some momentum. I was interested to hear that already there are more places in Peru besides the original Via Salvador. No, what was the name of the community? Yeah, Via Salvador that are now interested. And that is the way it works. It doesn't work so much top down. And in fact, we were involved in supporting the Ministry of Gender in working towards their national gender prevention plan. And like, they weren't even aware that this project was going on. You know, that's kind of the way these national processes work. And they're just so disarticulated from what's happening locally. So I think you're onto something. I do think one of the important things that I think it was one of your principles about potential is, again, I think we see, or at least can't quite tell from the presentation, so this may be slightly off, but as several people have said, when you're building off of a strong asset, like an organization like the Justa and communities that have more of that political base, again, I think there's a benefit of being very careful about where you start these kinds of efforts so that you're maximizing your potential to be successful so that others can then be inspired, and also you have less challenges and you can kind of figure out as you go, and you can solve the easy low-hanging fruit before you take on the more difficult things. So anyway, I do hope that UNDP will continue this work. And just for those who are interested, Erin works very closely with us. The work she did with UNDP was not actually part of the Prevention Collaborative, but very similar to the work that we do. And if anyone is interested, we have accompaniment programs and training online and otherwise. But I hope this will continue.
Thank you so much, Laurie, and thank you to all of our discussants and presenters. I'm really happy now to be able to open up to those in the room if you have any questions, but also reflections, comments that you'd like to share and to join the conversation with us, then please go ahead.
Thank you so much. I wish we had more time to get into the meat of these projects because they look really interesting, and but I'm still kind of grappling to really understand how it worked on the ground. I guess one of the things that's at the front of my mind, as you mentioned in the very beginning, there are very different contexts, and I wondered if you had intentionally chosen different types of contexts, if that was part of your thinking in this, and if so, how did that reflect on the approaches or the lessons? And if it was more of a convenience sample, maybe if you could tease out a bit more about how the different municipal or local level structures and funding streams and governance structures may have affected how you had to tweak your interventions, but also what that's likely to mean for the sustainability of funding this work.
Thank you. That's a brilliant question. Diego, do you want to maybe take a first try at answering that one, and then I can come to Mixing Italy?
I think, Erin, you may have some of the answers to this.
I mean, I think just Diego, on first maybe on the how they were selected. I know you're involved in I wasn't kind of, in terms of, I mean, I think they are very diverse, and part of that was intentional, but I think Diego would be interesting to hear a bit.
And really connecting with what Laurie said, that we were really mindful about having, a favorable environment so that we could really make the case. So for us, it was really important, first of all, to demonstrate the leave no one behind principle in action, right? So that we could really work in an environment that was dealing with poverty, or in the case of Indonesia, with a fraught political situation, and even in Gagosiya, which is a breakaway region in Moldova. Another criterion was that there was some appetite in that particular country for taking up at the policy level what we were going to do at the local level, and also what you were saying, Lori, in terms of really making sure that this is translated into policy, and it's really bottom up. And also, because we wanted to integrate it at the local level, we wanted to have countries and municipalities where you had already some kind of multi-sectoral discussion, right? And that's what we found in those municipalities that we selected.
Maybe just to add on your point around the different institutions, like the mechanisms for coordination in these very different sites. And I won't go into too much detail, and the report does go into this because they were such different experiences. And I think, in Peru and Mixi and Vitaly can share more, but there was, these instancias are actually mandated by government at Peru to coordinate violence prevention. But as Mixi mentioned, they're just not being funded, and they're just not being coordinated. And so this was just the role of UNDP, just to give a little bit of funding and support and coordination and get those moving. But it's working with something that the government has political will of, and in the video there's someone from the local government talking about how important these are, but it's just that support. In Moldova, they also have what they call multidisciplinary teams that are suggested by the government to inform the national action plan. But a real challenge the teams grappled with is they're much more structured in terms of who can sit at the table of those. So you have to have certain criteria. You're meant to be a social worker and a teacher and police and represent different sectors. But then, with some of these principles of leaving no one behind, ensuring we're intersectional, who is not then able to be at the table just because they don't meet that criteria. And so the team in Moldova kind of made efforts of how to still bring the multidisciplinary planning process with other community members, but was limited by these kind of government structures. On the flip side, it also meant that the multidisciplinary team is now also being replicated in other parts of Moldova. And there's there's been some really interesting lessons around funding that's come through kind of working through government bureaucracies and limitations has allowed them to access funding from the local level. So I think this is some examples of the very different constraints and opportunities that you're working with in different settings with these planning processes. I don't know if either of you wanted to say anything else in response, but.
So yesterday I spoke a little bit about the localization process, and it was a very interesting exercise for us because in one side, as a project, we better understood the local problems, the local existing resources, the local fears about the such kind of projects, because as it was mentioned, Gagosiya is an autonomy which never was done before in terms of preventing and combating domestic violence. But the situation is changed, and now through this project we reconnect the Gagosian region, Gagosian autonomy, to the rest of Moldova in terms of legislation process, services, and mechanisms to identify, to prevent, and to combat domestic violence at the local level. On the other hand, it was a very interesting exercise for local public authorities and for people from the locality, because it was the first such exercise when the local public authorities and the peoples stay together and elaborate local action plans. And it's a very good example when people feel that they are part of this planning process. Thank you.
En el caso particular de Perú, la instancia pertenece a la estructura legal del país, a la ley marco, a la 30364. Estas instancias o equipos multidisciplinarios locales, que son a nivel nacional y se dividen en los 3 niveles, no cuentan con recursos, pero sí con la capacidad para construir políticas públicas. Entonces, desde el modelo en Villa El Salvador, la propuesta era fortalecer y acompañar a este grupo multidisciplinario para la construcción de políticas públicas. Inserto allí herramientas de gestión local. En el caso del plan de acción local, donde hemos seguido la metodología de combos, tiene un proceso para que la propia instancia promueva nuevos recursos. La instancia como tal no tiene, pero el gobierno local sí recibe un presupuesto, es muy pequeño, pero lo recibe. Y en el caso de los gobiernos locales en los que estamos replicando, han asumido un compromiso no solo en el proceso y en la implementación, sino también un compromiso económico para desarrollar este modelo, que es el 30% de la intervención, sigue siendo insuficiente, pero la propuesta comunitaria de construcción de estas herramientas permite, y esperamos que así sea, dejar capacidades instaladas a través de los procesos.
Thank you. I think this work is really great. Congratulations to the team, Diego. I mean, I remember we've been talking about this for a long time, and to see these results of the local action plans is really great. And also to see that just the development of some of these plans have already positive outcomes on the community that can really bring to something bigger, right? I mean, but even now, just the development of the action plans, it's has positive outcomes. So, but also to show that even just this phase takes a lot of time and resources. So I would like to hear more about actually that, the time and resources that it took you to get to just this phase. That's one. The second, I also like that you talk about the challenges that are beyond the technical piece, even beyond patriarchy. The challenges that are bureaucracy, the challenges that are sometimes we don't mention in these type of forums, right? And but we face them all the time. For example, one is the challenge of the change of administrations in the local administration. So you are working with the local authority, the elections, then you change the administration, then you have to start again, and then so what extent you face that during even this process of development action plan? And I want to hear the experiences in the context of that. And the last thing is that is related again to the resources of the investment of local authorities to this, right? I mean, and we know that some of the main local authorities, ministries, local institutions that are more interested in these topics, like the ministries of women, etc., they have not much resources. The resources come from other ministers, the Minister of Finance, that kind of. So, at what extent that also, but these people don't have resources, they don't know this topic, they don't care sometimes about this. So, if you have experience of that, you talk to these people of the other ministers that control more the resources of the state, even at a local level, and it was also like a phase of involvement to these or institutions. Thanks.
Thank you. Congratulations to, just 1 minute. My question is quite connected to Manuel's one. I know that both in Peru and Moldova, you have developed a document on cost analysis of non-prevention of GBV. So my question is, how, and if so, if you have used and how this in an instrumental way to lead with, to solve these tensions that Diego in a very clearly way explained between the two levels, the political and the technocratic or technical level that you reminded me of Max Weber when I heard you. So my question is if you have used this in terms of getting more resources, right, from the technocratic to the political level to make them understand the consequences of non-prevention, right, of not including a cost analysis of non-prevention. And the second question I have is for you, Mixi. En términos de normas sociales, tú hablaste de el trabajo con masculinidades. Y yo sé, porque estuvimos muy cerca en todo este proceso, que han trabajado, ¿no?, en una iniciativa de masculinidades para la transformación de normas sociales. Si pudieras contar brevemente de qué se trató y qué impacto tuvo esta acción dentro de la iniciativa. Muchas gracias.
I can answer very quickly because we can discuss some more, but all your comments are really relevant. The first comment by Manuel, the cost. So we costed everything precisely because we knew that that's always an argument not to replicate, not to escalate, right? And through that document and that research that was done in Peru, we were able to demonstrate that by just investing, a small amount, you can, by reducing 500 women not reporting violence, it was already worth it, right? So that is taken care of, and you will see in the report. Then what you say about the political instability, let's call it that way, because sometimes it's just a new administration coming in and then you start from scratch. And sometimes it's real political instability, right? So I think that needs to be studied more because we have a change of administration, right? And I'm curious to hear from Peru. And then on your last comment on who are the budget holders, and sometimes it's the Ministry of Finance who has never been in Villa El Salvador. And precisely we are making those linkages because there is a huge disconnect. Devolution, I mean, they allocate some funds, but it's mostly for services that are already in place, but not to fund a local action plan. But that's, for us, the real challenge is you did a participatory process, you have a plan that really reflects the needs and the inputs of the community. There are no funds, even those, that are already allocated at the national level.
In the case of costing tools, the methodology was elaborated by the UNU Kuala Lumpur, and we were responsible to collecting data in Moldova, and all the report is based on the UNU methodology. But we received the report and the methodology 1 month ago. It's a new for us, and soon the government of the Ministry of Health and Social Protection in Moldova will start the discussions with the civil society about the new strategy on preventing and combating domestic violence. So we intend to present the results of this costing exercise, and we'll see the results of these discussions. But we can download the report from the website, from the UNDP Moldova website. Thank you.